Well, earlier this year, I brought you the extraordinary story of a Brisbane-based biotech firm, Ellume, a company on the forefront of COVID innovation. They have delivered millions of over-the-counter home COVID tests to the United States. But it's a different story here in Australia. The federal government is putting up a wall, not allowing the technology to be rolled out here. Dr. Sean Parsons is the chief executive of Ellume and a former critical care doctor. He joins me now from Brisbane. Dr. Parsons, I really appreciate your time. I love solutions in the middle of this crisis, not just more bitching and moaning. Help me understand, there is a difference. We're talking about two main tests that Ellume focuses on. There's a home COVID rapid test and there's a point of care rapid test, which is the one that goes out to medical professions. Help me understand the difference. And am I right in saying that both of these tests are available in the US?
That's exactly right, Peter. Both of these tests have been approved by the US Food and Drug Administration. The home COVID test was approved in December as the first home test of its kind to be used for people to detect themselves with COVID or for COVID. The professional use product has been approved last week, and that product is for use by doctors and nurses and pharmacists to be able to use on their patients to detect COVID. So the technology is very similar. Indeed, some parts are exactly the same, but the format that is used is different. One of them is designed for use at home by a person sitting at their kitchen table, and the other is designed to be used by a healthcare professional.
And just to help me out, once I do the test, let's say the home-based test, once I do the test, do I need to take that test to a lab, or will it give me results at home?
No, results in 15 minutes, Peter. Everything you need is you can buy in a kit, which is available online or in pharmacies. You download a free app to your phone. You walk through how to use the test step by step. There's a short video and then really simple to use instructions. The result, you take a swab of your nose, you apply that to the test, and you have a result in 15 minutes. That result is actually sent to your phone, so you have it there as a record. And if you want to send that result to your clinician or to your employer or to your school, then you can choose to send that on if you wish to. But you don't need to wait. You don't need to send it off to a lab. You don't need to wait till tomorrow. You don't need to call off the results. Everything's available within 15 minutes.
So if both of those tests are used in the United States, the second one, the one for practitioners, just being rolled out now, but the other one's been there for some time, how can the TGA here in Australia deny the test being available?
Well, the TGA, for the home test, the TGA aren't even able to review a submission. So Australia has a specific law which says for a notifiable disease like COVID, the TGA isn't able to review a submission to have that product approved for a self-test. That's a law that's been around now for some years. There was actually a modification to that law a couple of years ago to add a few illnesses to some exemptions to that list. Influenza, hepatitis were added to a list of exemptions to that a couple of years back. But COVID didn't exist then, and COVID is still not permitted to be a home test here in Australia. So while America is very forward thinking about this, they're trying to find new ways. In Australia, it's kind of the complete opposite. It's actually prohibited.
Yeah, of course, any law can be fixed. I mean, the Parliament's going to be back in a couple of days' time, so I'm sure it can fix it. But are we talking about legislation here, or are we talking about a regulation?
No, legislation. The TGA aren't even able to review it as the regulators.
And has there been any lobbying of the federal government to make a change so that the TGA could look at your test and it could be out there in the market for Australians? I mean, I could see heaps of applications. You want to go and visit a person in aged care, or you want to have an elderly person to your home. You could demonstrate that there's no one in your house that's got COVID, and it just gives them an extra level of comfort.
The federal government and Minister Hunt are well aware of Ellume and Ellume's technologies and where we're up to. Ellume hasn't specifically, and no one on behalf of Ellume has lobbied Minister Hunt specifically about these matters. But certainly the Health Minister's Office is well aware of what Ellume has to offer and what our technology can do. And you're exactly right. You know, the way it's being used in America is for people before they go and visit their grandparents, or before they send their children to school, or before they fly internationally. We have a partnership with Delta Airlines, one of the biggest airlines in the world, to test people before they return to America. Alaska Airlines, and so on and so forth. So there's lots of use cases of how the product can be used to help people return to normal life.
I can't understand why your phone is not ringing off the hook. What do you say to the fact that it's been created in Australia, but it's going to the US and we can't even use it here?
Well, it's just not very forward thinking. I mean, the Department of Defence partnered with us in February of this year with a $300 million grant or contract to develop this technology, to take to scale, to supply the US Department of Defence with 8.5 million tests, because it's unique tech that has platform capabilities to respond to this pandemic and the next one. And here we are in Australia with sort of the opposite of that forward-thinking attitude, where we don't want to consider it, we don't want to engage with it, we don't sort of see it as part of the future. And from my side, we can't continue to have these lockdowns, Peter. This isn't a viable long-term strategy. And I feel as though the federal government need to provide a plan for what we're doing next year and the year after. Are we going to continue with this lunacy of lockdowns, or are we going to chart a path out that enables people to get back to normal life, to manage the risks associated with COVID, and to enable us to return to something closer to normality?
I tell you what, this show at the moment with half the country in lockdown gets pretty bleak night after night. But Sean Parsons, I certainly give me hope, but I suspect you're giving hope to anyone watching tonight. I'm going to pick up the phone myself and call some people I know in Canberra and just ask what the hell is going on. I'm not saying I'm going to get anything to move, but it just strikes me as bizarre that you're not literally run off your feet filling orders in Australia. I really appreciate your time.
Great to talk, Peter. Thanks a lot.